Hello, I'm Dr. Ahmad Faisal. I am the president of Mercy Malaysia for the COVID-19 pandemic. I also am a consultant respiratory physician, as well as being an advisor on the advisory panel to the National Disaster Management Agency on health and emerging hazards, which of course includes this COVID-19 pandemic. With regards to our healthcare services, our health system, and our frontline medical and health staff, I think this pandemic has shown us the great need for a country, any country, to have a functioning, well-run, professional healthcare system that can be integrated easily and can function for all. The right amount of attention, the right amount of budget, financing is given to the Ministry of Health in particular, but also to the healthcare system as a whole. There are also issues with regards to health insurance, preparedness for a pandemic, the availability of specialist resources, especially outside of the Klang Valley, as we are seeing now. I certainly hope that these issues will be given a serious look at. We've looked at how the public system like the NHS in the UK has struggled with this. We've also looked at how predominantly private healthcare system like in the US. What we need is an integrated system whereby both public and private can merge together. And this, of course, allows for close interaction and integration of healthcare professionals from all three sectors, going from one to the other. All of us, regardless of whether we are healthcare professionals, ordinary members of the public, members of the security forces, whether we are in government, in the private sector, in civil society, NGOs, that we take a big lesson from this pandemic, and that number one, we must be prepared. And the second is that no, problems like this are not only for other people in some faraway country. We have learned in this pandemic that even our country can suffer, and we have. We must be prepared. Preparedness means not just material preparedness, but also individual, community, societal, and institutional preparedness. I hope that the economic impact of COVID-19 and its pandemic will not be as severe as we all think it will be. We hope it will not be, but chances are that it will be. We hope that Malaysians, like all other people in the world, will come together as one people, one nation to face the more difficult times ahead that may lie long after the pandemic has gone. The economic impact on a country like ours, which is still very much dependent on oil and gas for cash and liquidity, to certain major commodities like palm oil for export, and we're very much a trade and export-oriented economy. The impact is going to be great, and how we cope with that impact will test our mettle as a people, as a nation. I certainly hope that we can come together and not be divided by our differences, but rather be reminded of our similarities and commonalities, and that we come together as one nation. If there is one thing that the SARS-CoV-2 virus, which brings about COVID-19, has taught us, is that it has zero tolerance for any racial, ethnic, religious, positional, political, economic divide. It has no respect for who you are, whether you're Malay, Chinese, Indian, Sikh, everybody gets the same disease. There is no distinction between a prince and the lowest commoner. The COVID-19 disease will strike anyone. And therefore, we should learn from that and be more together and forget our differences and come together as one people. I hope that this will be the underlying lesson that we all heed. Let's pray and hope for the best. Thank you very much.